My husband was diagnosed with an inoperable brain tumor in 1990 and given 2 years to live. He was very, very sensitive to medication, and because of the brain tumor, it was in the motor cortex. Couldn't be operated on, but he started epilepsy because of it. It was partial seizures. He developed like a rash from Dilantin, so much so that the deacons used to bet how many times he'd itch during a sermon. And anyway, he developed mouth lesions, really, really bad. We went from one epileptic drug to another, and he developed white mouth lesions with Tegretol. And I told the doctor it was a rare side effect of Tegretol, and the doctor wouldn't believe me. And so he sent him to a throat specialist, and the throat specialist said, well, what is your profession? And he said, well, I'm a pastor. That's it, it's stress. It's caused because of stress. And my husband said, no way. I was diagnosed with this tumor. There are 4 months. I've designated driver for the day. They bring in food. This is absolutely the most unstressful congregation we've had. And so he came home and he told me this. And I said, I'm calling the drug manufacturer. And I said, how many cases have been reported? And they said 22. And I said, I'm reporting the 23rd. Went up to the doctor's office, and I said, I want him off that right now. And after that, I mean, he had so many allergies after that. He lived 23 more years. And the doctor would say, now Camille, which one should we try now? And when he was converted from Decapult to, say, Lamictal, he gave me the authority of how to do it, because he respected what I had done. But I had to prove myself. And I think a lot of times pharmacists do have to prove themselves. And once you prove themselves, they will ask advice, because he asked me advice about other things too then. Pharmacists deserve provider status because they know the side effects of medications, they know the indications which people ask about, and they also can co-work with like dietitians, they can co-work with the doctor, they can speak I would say the foreign language of medicine to the doctor, but they can also speak in lay terms to the patient. And not that many people can do that very easily, where pharmacists are trained in both. And pharmacists are getting more and more training in this. And the fact that they're also getting trained to go out in the community, not have to be paid for doing things. And it's not just like pharmacists getting paid to do this service. They can go out and give lectures to senior citizens. They can do other things like that make them accessible, so people will come and see them. And more expertise in the medicine, and I think we should be granted, because we have the expertise to do that, but we can also give alternatives to what to do, and people will again trust us.